Good day everyone, we are Group 3 and together with my groupmates we will be presenting a role play on family planning counseling portraying 6 types of contraceptives.
These are the contraceptive implant,
or emergency contraceptive pill or the morning after pill.
Diaphragm,
Vasectomy or male sterilization,
cervical secretion monitoring method,
and lactational amenorrhea method,
or the lamp.
So sit tight and we shall begin this instant.
Babe! Oh my gosh! I'm pregnant!
Really, babe? So I'm going to be a father. I cannot believe it. So let's set an appointment so that our baby will grow healthy.
Alexa and Kyle immediately set an antennal appointment with their general practitioner and a nurse scheduled to run all the tests, checks, and scans. After going through all the tests, the nurse set an additional virtual appointment for their postpartum family planning.
Good day. I have heard about this long birth control. What is this method? How effective is this?
This is actually a temporary family planning method based on the natural effect of breastfeeding on fertility. The effectivity of this really depends on the mother lactating.
If breastfeeding itself is not a contraceptive method, if the following 3 criteria of LAM are met, the method can be used as an effective contraception for up to 6 months after birth. So this includes exclusively breastfeeding, monthly period is not returned, and the baby is less than 6 months old.
So what do you mean by exclusively breastfeeding?
Exclusively breastfeeding means no other liquid or solid food is given. Also, the baby is fed on demand and often that is at least every 4 hours during the daytime and at least every 6 hours at night.
If the baby isn't frequently being breastfed, is there a high chance of being ineffective?
If there is absence of the baby suckling, there's a possibility for the ovaries to begin releasing eggs again. Will start ovulating, so the baby suckling primarily works by preventing the mother to ovulate.
With that being said, frequent breastfeeding temporarily suppresses the release of the natural hormones that cause your ovulation.
So, when do I start this method?
After initiating breastfeeding, start an hour within after giving birth.
So when should we know to stop using the method?
When menstruation has returned, this is an indication or a signal that the woman's fertility has returned. Therefore, breastfeeding or suckling is no longer effective in preventing ovulation, and its criteria limits its use for only 6 months.
Are you both planning to have your second child?
Yes, but we still have little knowledge in regards to the different postpartum methods. But wanted to use it to space the kids. But however, my wife Alexa is still quite nervous of trying methods of birth control.
I do understand, Sir Carol. This is why antenatal counseling of childbirth care is necessary. This is to help couples raise awareness of the importance of birth spacing and healthy pregnancy.
Right, but what's the recommended birth spacing for healthier delivery?
The WHO recommends it after giving birth should wait for at least 2 years but not more than 5 years before getting pregnant again for healthy pregnancy intervals.
I see. This is why postpartum contraception is really important. But still, I might quite have a confusion a bit as to when my fertility comes back. Do you think LAM is safe and good for me?
That's true, and yes, it is safe with no side effects at all. Even most all postpartum women can use LAM and exemptions are quite rare. LAM also benefits both of the mother and the newborn. It can be started immediately right after giving birth with no expense spent.
Considering that you would try this method, how would you personally take this information, Ma'am Alexa?
Well, LAM seems to be unreliable alone, as I've heard from nursing mothers, especially if their body isn't in agreement with the rules. Then, personally, adding an appropriate method of contraception while my body is still on it, I will probably provide myself a continuous protection. In such cases that I'll stop breastfeeding, start menstruating, or decide to supplement or feed my baby.
Well said. Additional contraceptions, like using condoms, will not only protect you from pregnancy, but also can protect you from STIs, including HIV.
And after the counseling, the healthcare providers was able to integrate postpartum family planning to the couple. Alexa was drawn to the information presented, and she accepted to use the method, but more likely to use a modern method of contraception later on when any of the criteria for LAM is no longer met by her, or even when all the 3 criteria are still met.
Oh my gosh,
What? What happened?
my condom broke.
What? No way! Jean, you have to help me. There's an emergency.
Why? What happened?
The condom broke when Kim and I were having sex.
Oh no. That is really an emergency. Come on, let's go to the health facility. I'm sure my friends, Nurse Joy and Nurse Julian, can help you.
Okay, let's go. Thank you.
Good morning, Miss Christine, Mr. Kim, and Miss Jean. I'm Nurse Joy. Together with me is Nurse Jillian.
Good morning. We are your nurses on duty for today. How may we help you?
It's really embarrassing, but the condom broke while me and my partner were doing it, and I'm really scared. Is it too late already? Am I going to get pregnant? I'm not yet ready.
Miss Christine, please don't be embarrassed. Circumstances like this actually happen. And don't panic because there's still something we can do.
Really? Oh my gosh, that's a good news. But what can we do?
Miss Christine may wish to consider using the emergency contraception pill or the morning after pill.
What is the morning after pill, Nurse Jillian?
The emergency contraception pill contains special doses of female hormones that is taken to prevent pregnancy after sex. If contraception was not used, a condom has broken during sex, or a woman has been sexually assaulted, the pill works by delaying the release of an egg during the monthly cycle. However, if fertilization and implantation have already happened, SCPs will not interrupt the pregnancy.
Oh no!
But it can actually be effective for up to 5 days after having unprotected sex. The sooner it is taken, the more effective it is. When taken the first 3 days after sex, it prevents about 85% of expected pregnancies.
If my friends would take the pill, what are the side effects? The common side effects of the emergency contraceptive include nausea, vomiting, headache, breast tenderness, and the next period may be delayed or early.
Where can I buy these pills?
Actually, Miss Jean, some types of emergency contraceptive pills are available over the counter at drugstore and pharmacies for anyone of any age without prescription from a doctor.
Okay, that's good to know. Thank you for the information.
But also, you have to consider that emergency contraception does not protect you against sexually transmitted diseases. And it must not be used as regular birth control method because it's designed for emergencies. Okay?
Okay, nurse. Thank you so much, Nurse Jillian and Nurse Joy. I somehow feel at ease already.
Thank you so much, nurses, for helping my friends.
Thank you so much for counseling nurses. We really need this information.
You're welcome, Miss Christine, Miss Jean, and Miss Kim.
If you ever have any concerns, please don't hesitate to visit us or give us a call. We would be willing to help. Stay safe, stay healthy, and stay protected. Bye-bye.
Thank you so much.
Good morning, Miss Remy and Miss Jane. I'm Priyanka Lado, the nurse on duty for today. Both of you are here for contraceptive counseling. Am I right, ladies?
Yes, you're right, Nurse Priya.
That's great. Is there something that makes you feel anxious about when it comes to using contraceptives?
Actually, Nurse Priyan, both of us are still single since birth. And this Friday night, we are planning to have some fun. So you know that, I mean, right? So however, we just want to be safe and protected. So can you suggest contraceptives that we can use?
Oh, okay. So there are actually a lot of contraceptives available. However, other methods such as the hormonal method and long-acting reversible contraception may actually take some time before it can guarantee birth control effectively. Perhaps you may like to try the barrier method if you really would push through your plan for this Friday night. The types of barrier methods that are available in our facility include male condoms, female condoms, cervical caps, and diaphragm.
A diaphragm? What is that? That seems new to me.
Well, Miss Remy, diaphragms are hormone-free and dome-shaped devices made of latex or silicone that are inserted into the vagina before sex. They prevent pregnancy by covering the cervix so that sperm cannot get into the womb to meet an egg. The first time you use a diaphragm, you will need a nurse or doctor to help you get the right size. And don't forget, they must be used with spermicide. It is a sort of gel which kills the sperm. If used correctly, they are 92 to 96% effective at preventing pregnancy. But remember, they don't protect you from sexually transmitted diseases, so make sure to use a condom.
So when should this diaphragm be used?
Well, it can be inserted up to 6 hours before sex happens, which is great because it does not get into the way of sex. But it should also be left in place for 6 hours after intercourse. They can be washed with soap and water and can be reused after using it. You can use it for 2 years before replacing them.
Wow, this diaphragm contraceptive might actually be a good try. What are its disadvantages, Nurse Brian?
Well, the downside of using this method is that it may cause irritation in the vagina, and it places you in high risk of acquiring urinary tract infection. Additionally, the diaphragm isn't a good choice for anyone who is uncomfortable or uneasy with the thought of reaching into her vagina.
So, well, I guess all contraceptives have its risk. So I really want to try this diaphragm actually. So how about you, Remy? What do you think?
I guess I try using it too. Where can we get it? Is it available in pharmacies, Nurse Brian?
Unfortunately, diaphragms may not be available at every clinic. And just like you have to be fitted in the first time, you also need to be fitted again in an ongoing basis, especially if you lose or gain weight or if you gave birth. So it's best to contact your health provider first before buying diaphragm.
Ah, okay. Thank you so much, Nurse Brian, for the information.
So we may consider trying this diaphragm. So thank you, Nurse Brian.
You're welcome, Miss Remy and Miss Jane. If you have any other concerns, just visit me or give me a call and I would be willing to help. Take care and stay safe.
Tess, is there a nurse that you can refer to us? Yes, because we're actually seeking for advice on what would be the best method for my wife not to get pregnant because we're not ready for having a one.
Yeah. I know someone who has a professional knowledge about your problem. It's Nurse Luz Reyes and Nurse Samuel Pepito. You can visit them at their public hospital located at 123 Vicente Golias Memorial Hospital.
Okay, we'll be going there now.
Okay.
Good afternoon. I am Alex and this is my husband Stefan. We are Tess's friend and she referred us both to you. Yes, because we would like to ask nurse if what are the best and simple way methods for my wife not to have a baby.
Hi, I'm Nurse Renalyn de los Reyes. So one of the methods that I would like to suggest is the cervical mucus secretion method. Perhaps you would like to try this. The cervical mucus method is a way to help you identify fertile times to help you gauge the best days to have or avoid unprotected sex.
Good morning, I'm Nurse Cyril. So, to use the cervical mucus method, it is important to know and understand how cervical secretion changes during typically menstrual cycle. So, these are the symptoms. No noticeable cervical secretion for 3 to 4 days after your period ends. Second is scanty, cloudy, and sticky secretion for the next 3 to 5 days.
Third, you will also have abundant, clear, and wet secretions for the next 3 to 4 days, the period before and during ovulation. Fourth, no noticeable cervical secretions for 11 to 14 days until your next period begins.
Thank you so much, nurses, for your help and for the information. We are now confident of hearing your professional advice.
Please note that you're most fertile when your cervical secretion are abundant, clear, stretchy, wet, and slippery, much like a raw egg white. So, you should have never sex during this time.
Yes, ovulation most likely occurs during or 1 day after your last day, also known as your peak day. You can have sex on other days except on this.
This is noted. Thank you so much.
Welcome.
So if you have concerns, just call us or visit us. Thank you.
Thank you.
Hello, Mr. and Mrs. Cruz. I am Abigail Abelia. You can call me Nurse Gail. So later on, Dr. Lumaya will be joining our meeting for Mr. Cruz virtual counseling on vasectomy. While waiting, let's start off. What made you both decide to consider having a vasectomy?
So it's something I've really considered since I gave birth to my twins 4 years ago. So I needed some time to emotionally recover from the trauma of 24 hours of labor. So I did not want also to experience ligation. So that's why we decided that vasectomy was really best option for my husband.
And are you both aware that this procedure is considered permanent?
Yes, we are fully aware of that, and we hear that the procedure is more than 99% effective at preventing pregnancy.
That is correct. However, vasectomy may not be the right contraceptive choice for you if you are relatively young, and if it is possible that you might decide you want children later. In some cases, a vasectomy can be successfully reversed, but the success of this procedure is not guaranteed.
So nurse, does this imply that my husband's sex drive will diminish or will the sperm accumulate in his body? So what about the risk of having prostate cancer after surgery?
Mrs. Cruz, your husband's sex drive, libido, erection, and performance will not be affected or changed because we are only preventing the body of Mr. Cruz from releasing sperm cells. Oh, good to see you there, Doc. By the way, Mr. and Mrs. Cruz, this is Dr. James Lumayag. He is our urologist, and he will be providing you more information so that you will be adequately prepared and informed in regards to the vasectomy procedure.
To fully understand vasectomy, it can be both for male and female sterilization. But unlike the male, the female vasectomy is more complex and expensive. Both have this permanent procedure to prevent unplanned pregnancy. Though there are still a lot of processes that need to be done in order to achieve the success of the vasectomy, and it's better if we can further discuss this matter face to face.
Thank you, so much, Dr. Lumayag and Nurse Gill. This counseling has helped us and enlightened us about what vasectomy is for male sterilization. After this, my wife and I will still discuss these matters privately.
Joanna and Vince are a newlywed couple that have decided they do not want kids just yet. They decide to go to see a nurse to see their options about contraceptives. Joanna and Vince are talking about how they don't want kids and they decided to consult with two nurses about contraceptive in a clinic.
Hello, we are your nurses. My name is Desiree and this is Janica. How may we help you today?
Hi! Today we're looking to see an options on what type of contraceptives we can choose from.
Do you plan on having a children?
Not just yet. Maybe in the next couple of years. For now, I am looking for a long-term form of birth control. Is that possible for us?
Of course. Well, you see, there are many types of contraceptives out there, such as contraceptive implant, emergency contraceptive pill, diaphragm, vasectomy, as well as many others.
Can you tell me more about the contraceptive implant? I am more interested in hearing about that.
Sure. The contraceptive implant is a long-term birth control for women. It is a plastic rod about the size of a matchstick that is placed under your arm. It releases a steady dose of progestational hormones to thicken the cervical mucus and thin the lining of the uterus or endometrium. The contraceptive implant can prevent pregnancy for up to 3 years. After those 3 years, you will have to replace it again. The contraceptive implant also suppresses ovulation as well.
What are the benefits and cons to contraceptive implants?
Some benefits to contraceptive implants is that it is an effective long-term contraceptive. It can be removed at any time followed by a trip to our facility, and it contains no estrogen. Some cons, however, is that it cannot be used if you're allergic to any components of the implant, have serious blood clots, have liver disease, have a history of breast cancer, and it doesn't offer protection against sexually transmitted diseases. And you can have a higher risk of an ectopic pregnancy.
Joanna, what do you think? Is this the type of contraception you want? If it's okay with you, and it's okay with me.
Yes, I have decided that this is the contraception I want.
Wait, We can set an appointment for you anytime.
Would it be possible to set an appointment next week?
Yes, we can. I'll mark it down in our calendar and you are all set.
Thank you so much for the help and counseling.